So I started using Argon Beam Coagulation approximately 2 years ago and pretty much have gone exclusively to that technology in all of my hip and knee replacements. I decided there was a push for tourniquetless total knees, and I was reading the literature, looking at products available, and I had heard about Argon Beam Coagulation, trialed the product on tourniquetless total knees and really liked it. Obviously, in the total knee, the Argon Beam Coagulation is extremely effective in exposure because that's where you're going to get the majority of your bleeding. With Argon Beam Coagulation, you can both dissect and coagulate at the same time, and the ability to do that does increase your efficiency in the case. It also helps with postoperative swelling and postoperative pain control if you can do a very good job of hemostasis during the surgery. Argon Beam Coagulation gives you the dissecting capabilities that you don't have with Aquamanus and those products. With the Argon Beam Coagulation, you're not switching back and forth. You have everything you need in the palm of your hand as you're doing the case. The precision of Argon Beam Coagulation is impressive, especially when you're trying to specifically address one area of the wound without coagulating anywhere else. I use it a lot for like parapatellar denervation. Rather than dissecting, I'm just using that beam for nerve ablation, and it does a very good job in hips to pre-treat areas. When you're using Argon Beam Coagulation for hemostasis, you get a nice eschar on the wound bed or wherever you're addressing, and at that point you don't have to worry about a lot of breakthrough bleeding. I would say the biggest advantage is when you make the jump to tourniquetless total knees, as far as the hemostasis you can get, and you just have to try it.